My name's Chris Harding. I'm a urologist from Newcastle upon Tyne in the UK, and I'm the chair of the Non-neurogenic Female Lower Urinary Tract Symptoms Guidelines panel. So this year we've built on the scope change which was introduced in 2021, where the incontinence guideline was expanded to include all female lower urinary tract symptoms. I think specifically this year we have included patient representatives and a nurse representative on the panel, and that's led to some important changes in the guideline. And I think possibly the most important change in the guideline has been the underlining of shared decision making in terms of process. So we have, for instance, in all of our recommendations for the surgical treatment of stress incontinence, introduced an addition to the recommendation which has recommended a thorough discussion of the risk and benefit profile of all of those different options. So I think the most impactful recommendations really, rather than pick out a single recommendation, are again the coverage we've given to novel emerging treatments. So one example would be laser treatment for overactive bladder. We've emphasised the need, and this has been based on perhaps other treatments that have been introduced for incontinence over the years and perhaps the controversy surrounding surgical mesh. So we've emphasised the need that any novel treatment should be part of a well-regulated clinical trial before we can make a strong recommendation. So in the last 12 months we've published 2 systematic reviews, both concerning female bladder outlet obstruction, and they've both underlined the poor quality evidence in this topic area. So I think going forward I would encourage researchers to perhaps collaborate, use unified PROMs, homogeneous populations, and that will enable future meta-analyses to be much more productive and fruitful.